Hey everyone, today we're going to be talking about Helicobacter pylori. This is a gram-negative spiral bacterium which is known to cause stomach ulcers. It's a fascinating microorganism which has some pretty intense mechanisms and tools it uses to operate in the acidic environment of the human stomach. While we know it to be the cause of most ulcers today, this discovery has a very interesting history, particularly because H. pylori fails to meet Koch's postulates, the set of criteria used to determine whether or not a certain bacteria causes particular disease. Its failure is on several grounds. First, H. pylori is found in many individuals with no disease. Around 80% of people with this microbe have no symptoms. Next, due to the fact that infection does not always cause disease in the host, the step in Koch's postulate about isolating bacteria from a diseased individual is impossible. Barry Marshall had limited models to use and struggled with these obstacles in Koch's postulates. Because of this, he was driven to infect himself. He drank a concoction with H. pylori and monitored himself as a model. He got sick, isolated and cultured the bacteria, and treated himself with antibiotics. He had developed gastritis, indicative of stomach ulcer formation. His groundbreaking work linked ulcers to H. pylori, but you should never drink anything in a lab setting like he did. This is really questionable practice. Now, let's look at how H. pylori operates. It starts in the highly acidic stomach lumen and chemotaxis using flagella to an area of lower pH. It swims, screwing in with its spiral shape into the mucus lining of the gut, and gets close to the host's epithelial cells. A very interesting and key feature is the bubble it creates around itself. It secretes protease, mucinase, and lipase to break up the mucus, while also utilizing intercellular urease to secrete ammonia and buffer low pH, raising the pH around it. Now, here comes the danger. H. pylori uses a type 4 secretion system, which is like nature's syringe, to inject CAG-A. This is a toxin causing cell damage and the rupture of the mucosa. H. pylori also secretes VAC-A, a toxin which creates a vacuole from the cell membrane as H. pylori enters into the epithelial layer. H. pylori can then enter this vacuole, colonizing and eventually causing apoptosis and mitochondrial dysfunction. Further damage is created by an opening to the acidic stomach lumen, which is dangerous once the epithelial cell boundary is compromised. Now here's a quick recap. VAC-A creates a vacuole, helping with colonization and leading to apoptosis and mitochondrial dysfunction. Stomach acid can flow into the damaged mucus layer and broken epithelial barrier. It can cause ulcers. CAG-A is sent in with a syringe. It causes actin remodeling and is linked to cancer and signaling disruption. Here's another quick visual with all these interesting virulence factors making this bacteria so powerful. Here is a helicopter flying in with Helicobacter, a fun way to remember the name. Once infected, a patient is treated with antibiotics like amoxicillin, clarithromycin, and metronidazole. The function of these is a topic for another video. Additionally, to help with the repair of the epithelial cells, drugs like dexlansoprazole can be used to reduce levels of stomach acid. And there you have it. I hope you enjoyed this quick overview of the history and function of H. pylori. It's a fascinating bacteria with an incredible arsenal.